Okay, good evening. Welcome to Asia Society Hong Kong Center. It's 8 o'clock in the evening here in Hong Kong on April 16th, and it's episode 11 of the coronavirus COVID-19 update. And we're really delighted that tonight, we have Professor Rebecca Katz with us. And before I introduce her, just kind of the headlines as of today. I think the numbers here in Hong Kong are very encouraging. We saw one new case today, and Hong Kong's number is 1,017, and then 4 deaths. Whereas in Singapore, I believe the number has gone up to 3,699, 10 deaths. In the US, of course, the numbers are not as good, 28,000 and over, I believe, 600,000. Globally, the numbers are also 130,000 worldwide, and then 2 million infections and 130,000 deaths. Here, another update, White House is targeting May 1st as a possible date to lift social distancing, and we're going to ask our expert to see if that is a realistic date. And also, President Trump has announced the halting of U.S. contribution to WHO, pending review, 60 to 90 days review. The 400 million per year contribution that U.S. makes to WHO is pending review. So this is just the kind of the headline as of today. So we're delighted, Professor Rebecca Katz, the director of the Center for Global Health Science and Security at Georgetown University Medical Center, is with us this evening. And Dr. Katz is based in Washington, D.C., and her specialty is global health diplomacy, global health security, and emerging infectious diseases, where she's taught at the School of Foreign Service. And since 2007, much of her work has been on the issue of domestic and global implementation of the international health regulations. And from 2004 to 2019, she was consultant to the Department of State, working on issues such as biological weapons convention, pandemic influenza, and disease surveillance. And and she also in 2009 co-convened the first international scientific conference on global health security, bringing together over 900 participants around the world to form a community to talk about this issue. So we're really delighted that Professor Katz can take time from her very busy schedule from Washington to join us. Welcome, Professor Katz. Welcome to Asia Society Hong Kong Center. And I want to start so much by asking you from where you are standing, where you're sitting in Washington, kind of give us what are the recent developments in the past week in the United States that you are kind of most concerned about, or that's something that you're keeping an eye on from Washington?
Well, again, thank you so much for having me, and delighted to speak with you and your community. You start with a tough question, and it's tough because there's so many things that we are monitoring right now and trying to get a better understanding of. I mean, clearly we're still, we learn more about this virus every day. We are, so we're watching the science develop. We're watching we're watching kind of the natural experiments of countries all over the world who are taking slightly different approaches to containment and mitigation, and to thinking about even reopening and relaxing measures. And every time any government does that, we all watch very carefully, right, to figure out what is working, what is not working. I think from my perspective, the things that I am looking at right now, focused in the United States, I think there's a couple of issues that I'm monitoring. One is the challenge of testing. We've now conducted in the U.S. Just over 3.2 million tests, yet we're actually reduced a little bit the number of tests that we're able to do every day. So why is that? and what are the challenges? Why can't we fully deploy rapid testing? And that's critical, because as we listen to the political leaders talk about reopening and these May 1st dates and discussions that are happening from the White House, I don't know how we can do that without better understanding what our burden of disease is, who's infected, the ability to do rapid testing, and that's even linked to the CDC and FEMA came out with a kind of a framework for helping the country think about how to reopen, I guess, and but their framework is predicated on the ability to be able to understand, to do a community assessment, to understand what the risk is within a community, to be able to test, to be able to have sufficient personal protective equipment, and then a series of steps after that. So all of this is predicated on the ability to test. So testing is one of the things that I'm watching carefully. As you mentioned, I care a tremendous amount about global health diplomacy. So watching what's happening with the discussions around the World Health Organization. And I think the very bad decision of the government to announce a cessation or a pause in funding. So how do we think about that? How do we address it? How do we save multilateralism? And then also watching carefully, well, again, lots of things, but looking at issues of the food supply, looking at issues of the kind of the second order effects of what's happening to societies, what's happening to things like domestic violence, what happens when you impose physical distancing orders on communities. But then also looking at some of the interesting governance regimes that are springing up. So we're seeing collectives of governors who are kind of grouping together to figure out how they work collectively. We're also now seeing the parallel kind of a consortiums that are forming amongst city leaders. So while the governors are coming together, we're also seeing major cities come together to think about and share their best practices and coordinate their activities. So that list is a little bit all over the place, and I'm sure I'm missing a whole bunch of things that I'm looking at a regular basis. But that's a starting point.
Well, can you then, one of the questions is really talking about your work. Not only are you a global expert, but you also, like you say, work a lot with the local leaders and whether it's governors and I know you also advise the mayor of New York. So can you talk about your work in this area in terms of leader, the municipal leader as well as governors, and also where we're seeing now too, also again, President Trump about the coordination. He's in charge as president. Can you kind of touch upon that? I think for some of the people here in Asia, where we're not as used to seeing Hong Kong is 7 million. We've regardless of the trust in the government, the government has been able to, we've implemented the social distancing in this last 2 months quite successfully. We would say Singapore also has its challenges, but again, Singapore is a 5 million a city state. It's a country. So what's the challenges of the the federal and city? Because I used to work for a state of Ohio. That's where I started my career and then people have said the Ohio Governor DeWine has done a good job compared to the other governors. So if you can kind of give us a kind of a idea of the challenges, federal as well as state and city, that's facing this. And in some ways, this number is right now, the US numbers is the largest in terms of the case and also death. So what are the challenges in terms of coordination and how effective and also advice to some of these leaders in your capacity as an expert?
So first, I'm going to start with a little bit of a clarification. So there's my name is somewhat common. So it's actually a different Rebecca Katz who advises and works with the mayor of New York. But I've actually worked closely with the health commissioner Dr. Barba, and colleagues in the New York City Health and Hospitals. So yeah, just want to I don't want to take credit for anybody else's work.
So we need.
But I have actually spent a good deal amount of time over the last 10 years thinking about the role of cities, and initially looking at just the spread of risk, right? So when we thought about infectious disease risk, it was often thinking about it from one international airport to another, and sometimes the mega cities of the world actually would have more in common than national level governments thinking about their their whole of government and whole of country response. So we've been thinking a lot about the role of cities in infectious diseases for many years, and several years ago, I became involved with, as you know, there's lots of different networks of cities. I think there's over 100 of them, from the C40 and Focus on Climate Change to all these different networks. And one of the ones that I work with is called the Global Parliament of Mayors, which has approximately 100 mayors from around the world. But it also includes the U.S. Conference of Mayors. So that's the kind of umbrella organization for most of the mayors in the U.S. And several years ago, we actually started a track within the GPM on pandemic preparedness. Since there are lots of these networks of cities, but many of them, if they focused on health, they focused on non-communicable diseases, road safety, things, some of those shared threats and hopefully shared solutions, but none actually looked at infectious diseases and the threats of pandemics. So we became very involved in working with this team of mayors, and have continued to do so, and helped shape our research agenda, as well as thinking about the very specific tools to help create. So one of the tools that we created was actually a rapid assessment tool at the city level, the municipal level, to think about pandemic preparedness that was very much borrowed from the WHO's assessments at the national level for the international health regulations. So we have been doing a lot of that work with this team, this group of mayors from around the world. And then when COVID hit the U.S., we started doing a lot of, basically we'll provide public health advice to anybody who asks, and within our capacity. And so we started to actually get a lot of requests from cities. And at one point I was on the DC Homeland Security Commission that was working on pandemic preparedness. And we've been speaking with governors and a governor task force and mayors from across the US. We also created what we call covidlocal.org. So we created a frontline guide for municipal level decision makers to figure out kind of what were the main questions they needed to be asking, as well as thinking about what like a public health emergency operations center would look like at that level. And the reason we did this was kind of get to your question. We were able to identify years ago that in the case of a pandemic, or any large infectious disease outbreak, we know it's the municipal leaders who are the ones who have to make the decisions. They're the ones who have to decide if you're going to do a quarantine. They're the ones who know where the vulnerable populations are. Depending on the authorities, they may control their first responders. They may have hospital systems of their own. Not always, but sometimes. So it was very much, we knew that there was always going to be a national level policy. There may be some intermediate level policy, but at the core, it was often going to be the local level leaders who were managing the kind of the day-to-day operations of an outbreak. But we also knew that very seldom did the guidance actually flow down to that level. So most countries have a pandemic preparedness plan. Again, I think Singapore and Hong Kong are a little bit different, and have always operated a little bit differently. But most countries had a pandemic preparedness plan, but most of the mega cities did not. So so they may have had something that said, oh, we'll just look to what, the government, the national level government has done. And a lot of the resources hadn't slowed down. So, so something that we've always been very concerned about, and I think this pandemic has certainly, in ways that we never wanted to have to imagine, clarified the role of city leaders, and that all over the world, city leaders are having, from small cities to mega cities, are having to basically manage this outbreak and protect their populations and make decisions. And sometimes they have guidance for that, sometimes they don't. Sometimes it's a coordinated effort, sometimes it's not. And we started to see, we found out yesterday there's actually a consortium of small city mayors in Uganda that have banded together to help each other with decision making. We heard yesterday that while the governors of the West Coast in the United States are coming together to coordinate their planning, so are the mayors of the major cities on the West Coast. So the LA, San Francisco, Seattle. So they too are kind of coming together to make sure that they're learning from each other, that they're not out on a ledge by themselves. So they're incredibly important. They are the front line in decision making, but often they don't have the capacity. And to your earlier question, it gets really messy. So the mayor of Seattle, she doesn't control the health department. The health department is for the county. And so the county health department reports to the state health department, doesn't actually report to her. So, that they're clearly coordinating and they're getting information from each other, but the chains of command don't always line up. And in some places it works better. So in New York City, there is an incredibly robust health department and a commissioner of health for the city. And it rivals the health departments of many states. And New York has its own set of 12 hospitals that it runs for the public. So again, really uneven in terms of the capacities and the authorities that some states and cities have as opposed to others.
So going back to the city and last week, a few weeks ago, I think Governor Cuomo sent out really an urgent request for ventilators and a lot of the equipment. Mm-hmm. One of the statements he had said was, we're at the forefront, help us first in terms of supplies, and then, it's a wave and we will help the other states. And some states like Oregon have also helped in terms of providing supplies and so on. So do you think that's a policy that works in the United States? Because, some of the states cities maybe are at the forefront of the issue and then they get the support first. Or is it, sometimes I kind of get the sense when it comes to the medical equipment and all that, and ventilators especially, I think everybody to themselves. And so and we're talking about also the piles of ventilators. So I think Governor Cuomo had asked maybe the president about that. I mean, obviously that there is a lack of coordination, I guess. And I think we've seen that too in the United States. I remember FEMA, I think we remember Katrina and all that. So I think that challenge, it seems to me we're seeing it now in the public health sphere in the United States.
So ideally, the federal government would have stepped up to offer to fully coordinate the national level distribution of PPE and equipment, and that was part of the plan. And I think that we have a strategic national stockpile. We've had it since it was not designed necessarily for what is happening right now, but there was still basic infrastructure in place. I find it, I think, disappointing is probably the kindest word that has not happened, and instead the government has decided to basically let the governors and the mayors fight it out for themselves, which has created a bit of chaos, to be frank. And I think initially more chaos than not, because the states were suddenly on their own to try to figure out, how do I get the equipment that I need for my population. Subsequently, certain states have started to band together and kind of recreate the coordination mechanisms that I hope that the federal government would have provided, in order to be able to move things around. And not every locality is peaking at the exact same time, and so to be able to share ventilators, to share PPE when it's available. So I think that is starting to happen, but it's happening in a bit of an ad hoc way.
Yes.
And that I find that disturbing and also baffling for many of us who have spent the better part of 20 years thinking about pandemic preparedness and trying to put sufficient plans in place.
Well, I think I have to give Asia Society a plug. We got shout outs from the governor of New York and California for helping to coordinate some of the shipments, so we're really delighted we could play a role, but sometimes I wonder if other people are better equipped to play that role. But I'm so glad our colleagues in the US and here in Asia have helped in this endeavor. Now I want to kind of turn to the question of quarantine, or just some of the issues. You have studied this. You've spent decades researching this. Which country, in your view, do you think have implemented it the best? We heard, I think, right prior to this, I was reading up on the different approach between what Germany has done and what UK has done. I think Germany was probably slightly ahead of UK in terms of some of their social distancing rules and so on. And I think even now, Angela Merkel is going to lighten it up a little bit, but still maintain until and then we've seen Europe, and then also here in Asia, a very different approach. And in Hong Kong, we cracked down about 3 weeks ago, because when we saw the returnees, Hong Kong's case was only about 200, and then we really and unlike, very similar to Singapore's case, so we had the closing of the pubs, spas, and gyms. We're hoping that'll be lightened up in a bit. But schools have been closed in Hong Kong since Chinese New Year, which Singapore only last week, I believe, closed the school. So I think everybody has different approaches. And so faced with this, how do you think how do you strike the balance between mitigating the spread of the virus, but also protecting the rights and liberty? I mean, how do you, everybody does it differently, and right approach or wrong approach, and how would you advise some of the mayors that you're working, that you have the possibility of talking to?
So you're right. We've been studying quarantine and isolation for a long time. Talking to nobody, because nobody was interested. And I think it's important to think, how do we define the word works? Like you said, did quarantine work? I think clearly we know that an effective physical distancing measures slows the spread of disease. We know that. We have evidence, and every day we get more evidence. Now, you're absolutely right. What does work mean? At the risk of and by definition, when you curtail somebody's movement, you are curtailing their civil liberties. At what cost, and to what extent? And that is kind of a compact that well, it's not a compact that most people thought about very often. But I used to talk about quarantine a little bit like jury duty in the United States. So people get called for jury duty, Nobody likes it. Nobody wants to do it, but you do it because it's part of your obligation as a member of society, and everybody around you understands that. So, you know, you're not fired from your job. You're compensated, even if it's minimally. And there are practices in place to support this. And everybody feels sorry for you. Oh, you're stuck on jury duty. But you do it, and everybody acknowledges that you are doing it as part of a member of society. And quarantine is a little bit like that, right? Because or it should be, in that it's something that nobody wants to do it. You do it because there's an obligation to be a member of your community, and doing it protects your community. But everybody recognizes that it's a sacrifice. And so, you know, how do we ensure that there are kind of the safety net in place to ensure that that sacrifice is acknowledged and supported? So whether that is, you know, one, ensuring you don't lose your job, or, you know, ensuring that there's that there's some type of compensation that you're not gonna, you know, not be able to pay your bills because you're participating in this public compact. And how do we think about noncompliance? So if you don't show up for jury duty, you get in trouble. You know, it's not a huge deal, and you get a warning, and then a second warning, and then you get to a point. But at the end of the day, if you totally ignore it, you get in trouble. And it's a little bit like quarantine too, and there's ways to think about it. And I think certainly watching what Hong Kong and Singapore are doing around noncompliance becomes a bit of a challenge. So I think we all hope that people will comply. And I think that there's an important aspect of thinking about assuming that populations will comply, but having tiered steps in place for addressing noncompliance. And it seems clear that many in Asia, particularly countries that have had experience with having to do these types of quarantines in the past, have worked through that in ways that many parts of the United States have not. So, you know, the idea of, you know, if you are violating once, then this is what happens twice. And are there rules on the books that, you know, if you've ignored all the warnings, you know, what are the consequences, and whether that is eventual incarceration or fines or increasing fines. Again, a lot of the United States has never kind of gotten through that. So sometimes they jump to, or we saw during with people returning from West Africa during Ebola, that some localities would actually just jump over this idea of voluntary quarantine and go straight to putting like a law enforcement outside somebody's door. That makes it feel like you're criminalizing the people who are part of a public compact, who are doing their part for society. So I think, you know, there's definitely some theory and ways to best approach this. Now, what we've also seen is that there's ways to monitor how well people are doing and compliant. And I think clearly countries that have been through these types of infectious disease threats before were much more compliant early on and willing to engage in these physical distancing measures. I think there's all sorts of political theory where you can look at what your form of government and your trust in government and the relationship between the population and government and trust to predict what compliance looks like. And I think, so in Germany, for example, compliance has been exceptional. And because of that, they've been able to, as you were saying, start to think about relaxing some of their measures, because they know that they can also reinstitute them if necessary, and that they have very good kind of testing and tracking going on. Some of the tools that have been put in place, say in China, when when some of the measures have been relaxed, such as the QR codes on phones and the kind of very detailed contact tracing and monitoring of the population, which makes a lot of sense from a purely public health perspective, I'm not sure will work very well in an American context. And so I think there's a lot of folks in the United States who are starting to think about how do we look at some of the models in different parts of the world and figure out how those can be adapted to be as compliant as possible with the levels of civil liberties that Americans assume that they will have, and what compliance might look like.
Well, then this is a question that, it's about the, what do you think of the collaboration that was recently announced between Google and Apple on the development of the contact tracing app? Using, I guess they're guaranteeing, they're saying it's using Bluetooth rather than other technology. They're not asking you, but in some ways they are. How do you now, can you kind of talk about that a little bit? Would really help enlighten the issue. These are two giant.
So
it has not.
Yeah, so,
mid-May, I think, is the target date, I guess.
Yeah, so it hasn't rolled out yet, but I'm ready. I got my phone ready, and I'm ready to download the app. I think I think contact tracing in general. My thinking on this in the United States is going to be a mix of trying to figure out how to adapt technology with a workforce. We're going to have to create an army of contact tracers, and some states have already started to roll that out. Some places haven't. And there are some places who want to, but don't have the funding to figure out how to do it. I think my understanding of this new app, and there's several other more smaller academic teams that are trying to do something similar, is that it's opt-in. So you opt in. I think there's two very important aspects. That one, that you opt in to be part of it. That the idea is that it would, using Bluetooth technology, it would, it lets you know who you're. So if I was out and about, and I shouldn't be right now, but if I was out and about, and I then get a test, which I can't at this point, and then I test positive, I then opt in to tell this app that I've tested positive, and then the technology would then ping anybody for whom I was in contact with within 6 feet over the course of maybe the last 2 weeks. I don't know what the parameters are yet, to let them know not that it was me, but that their phone had been within physical distance of somebody who had tested positive, and therefore they should think about getting tested. My understanding is that so one, I have to opt in to be on the app. I have to opt in to tell the app that I tested positive. And my understanding is all the data filters through public health, which is critical. But it doesn't matter. It doesn't work unless there's actually a system to get tested.
Correct.
Unless there's a system and there's a robust public health capacity that could then go out and verify and track people down and ensure that, again, testing, what's the saying in epidemiology is surveillance without response is just documentation of misery. So, it doesn't matter if you test unless you then do something about it. So, can we then follow up tests to ensure that anybody who does get tests is identified, whether they're isolated, whether their families are quarantined, whether they're able to then receive treatment, what that treatment looks like, and continuing that cycle. So I think the technology is wonderful, and I've said this often over the last couple weeks, but I think it's important to just keep saying, we've been a relatively small community in the past that's been thinking about pandemic preparedness and health security in general. And one of the few silver linings for this pandemic is that every single smart person in the world is solely focused on pandemic preparedness. And in some ways, it's a little bit of a challenge because I think anybody who now knows how to do math thinks they're an epidemiologist.
Right.
And we have to manage that a little bit, but also think about all the new innovations that are going to be coming online, and how do we harness them in a way that is scientifically valid, that is consistent with our norms, with our values, and helps to mitigate this pandemic, as well as also build capacity for future ones. So I think there's a lot of exciting technology. Part of our one of the things that we're now responsible for doing is figuring out how we integrate that into kind of best public health practice.
But I guess my concern is like technology is a wonderful tool, but it's also a Pandora's box in some ways, in that it's a double-edged sword because a lot of people. One of the reasons this program got started when we kicked it off on February 14th was that we were getting so many, and this is the beginning of Hong Kong's, we were getting news from China, fake news from US, the world. And one of the reasons we is to ask the experts like yourself, directly ask the experts. And we're going to come to the question from the online audience shortly, as to kind of get rid of this, and right now, even to this day, a lot of people are still believing that COVID-19 was manufactured in a lab. Some believe, in fact, I think there's been sabotage, UK, of 5G towers, and even in Canada recently, there's a group, maybe minority, of protesting the social distancing rules and so on. So, for every positive, the flip side of it is the negative in terms of the fake news, and how do you also counter that, and also the trust in government, in that, the data can be used by so-and-so, this secret government or whatever. So I guess, how do you convince people? And now this is also an election year, which I will also talk about a little bit. It's like, it's everything is kind of in some ways politicized a little bit or a lot. And so how do you, in Hong Kong, despite what we went through this last couple of months with the protests, because maybe of our experience with SARS, people wear masks. And Singapore just announced that they are going to be fining people who do not wear masks. But in Hong Kong, it's go to the subways, it's just been so natural for all of us to be having a mask in our pockets and so on. So how do you now kind of balance that, the positive with the negative, and build trust in either the government, the system, or the infrastructure?
So this is where I know what I know, and I know what I don't know. I think public health does not have a long history of being very good at either risk or crisis communication, and is certainly struggling with misinformation. And in fact, back a year ago, long time ago, WHO actually listed misinformation and vaccine hesitancy due to misinformation as one of the top 10 threats in global health. So I think that the community has recognized that this is a challenge. I don't know how to fix it. I think and I look towards people who are smarter on this than I am, to communications experts and media experts. But I think what we can do in our community is just try to be as clear as possible about the information that we do know, to recognize the information the information we don't know yet, and to ensure that we are communicating regularly and accurately to the public. And I have to say, that's not something that's was not being done very well in the United States early on. There is now a daily White House presser, for better or worse. Sometimes it doesn't exactly stay on target. At least now they've stopped standing side by side with no masks on. So at least now they're actually at least practicing physical distancing themselves. But there absolutely does continue to be a lot of conflicting information, and people who are able to manipulate social media and media in general to be able to push out their own message. I will leave that to you and others to figure out how we fix. I'm just going to focus on the public health.
Well, now we're going to go to our online questions, and one of the from our audience is, what's your take on the hydroxychloroquine? What is your take on that?
So my take on that is the same as my take on many of the, say, 100+ different antivirals and therapeutics that are being studied at the moment. They're being studied at the moment, which means that there is a process that we have in place. There are clinical trials. There are ways that we collect evidence to determine what medical countermeasures are effective and what aren't. Given the urgency of this pandemic, we are seeing rushes to preprint and rushes to publications in ways we've never seen before. It's an amazing way to share information, but it has to be shared with the understanding that many of these studies are just preprints. They haven't even gone through the peer review process. Many of the initial reports on certain treatments are just that. They're initial reports, but we don't yet have all of the evidence that we need to make an effective assessment of what medical countermeasures are working and what aren't. I think specifically on hydroxychloroquine, there's conflicting data out there. There have been studies that have actually been stopped because of concerns about heart conditions and other side effects. It is clearly a drug that requires careful dosing. And I don't know if we have enough information yet to say definitively this works for this population when delivered at this date or this period of time in the course of symptoms, and this is when it doesn't. So I will continue to reserve judgment on pretty much every medical countermeasure at the moment. And I should note, I was making some notes. There are currently about 100 different medical countermeasures that are currently under investigation. This is just one of them. And there's currently 70 different vaccines that are in development. So we have a lot of different concurrent efforts going on all over the world.
Okay. This is another question from the online audience. I understand you're advising the Biden, you're a medical advisor on the Biden campaign, and he's now our Democratic, he with the endorsement from President Obama and the other candidates, he's it, right? So what is your advice regarding the campaign methods that may be coming up? Do you DNC 2020 remotely done, Zoom debate with Trump, and safe to vote in person in November? So these are some of the questions related to the election.
Those are all excellent questions. So yes, I'm very honored to be on Joe Biden's Public Health Advisory Committee, which is made up of there's a number of us who have public health and medical expertise. And I should just point out that our role is not the development of policy for the campaign, but to provide public health advice to ensure that Vice President Biden, Dr. Biden, their campaign staff, they are all safe, that they're thinking about the safety of their of the country in their operations, and thinking about how do we preserve democracy in the fall, but at the same time ensure population health. So I think the questions about voting, about the debates, about a convention, I have my own thoughts, but they are also evolving, right? I think it's I don't know what August is going to look like in the United States. I I actually don't know yet if it will be safe to have a convention where you have lots of people coming in for a mass gathering. I don't think any of us know that yet. I think there are challenges to figuring out how to continue to move forward right now, how to think about what the future looks like. And I also think that there's a lot of discussion happening right now about how to ensure that people are able to participate in democracy, to vote, and do so in a way that doesn't compromise their own health.
And this question is also kind of related politically as well. This question asks, if everyone in the US had access to universal health care, would today's crisis in America be noticeably better controlled? Will this shape future US health policy?
Well, that's a crystal ball I wish I had. I don't know. Clearly, the debates around access to care in the United States have been going on for a long time, and no doubt will continue. I can say that it is one of the things that this pandemic is shining a light on is some of the racial disparities and access to care challenges that the United States has. So we are seeing an inappropriate, truly unfortunate disparities that are happening right now, where in some cities where African Americans make up maybe 30% of the population, they account for 70% of the deaths. That is not even including the number of people who we're not yet counting because they may have died at home without any access to care. We do know that even testing is a challenge and can be a financial challenge. So there absolutely continues to be access to care challenges. There's racial disparities. There are all sorts of challenges that the United States has in our healthcare system. I will also tell you that our hospitals right now are losing between $3 and $5 million a day because of the way our system has, the fact that elective surgeries has been halted. We are seeing our physicians, who are our frontline healthcare workers, who are actually in some cases getting their pay cut because of the way our reimbursement systems work. So I think there are, I can't, the list of all the challenges we're going to face is so long, I can't even get my head around it. I don't feel comfortable trying to predict what that will mean for changes in our healthcare system, though. But clearly, and we've published on this before, universal healthcare and global health security are intricately linked.
Okay, well, then let's come back to the question of COVID-19. Harvard T.H. Chan School of Public Health researchers just published a study. In fact, we just read it today, and also it was a coverage yesterday, that the reemergence of the virus is going to be possibly in the next 3 to 4 years, and we may have to practice social distancing or intermittent social distancing from until 2022, if no vaccine is found. Do you agree with that? Is that something that we kind of have to look forward to this next couple of years, living COVID-19?
Well, my daughter read that study. She's a teenager and came to me quite distraught last night to ask if we're really going to be stuck in our house for another 2 years. I don't know. I think that this is a pretty horrible virus, that there's so much we still need to learn about it. We started to do a lot of models early on based off of what we thought we might understand about immunity. Some of those assumptions about immunity are now being challenged as we get more data. This is a really hard virus to create a vaccine against. We had hoped that we might have one in 12 months. I have no idea. It might be 12, it might be 24, it might be 36 months. And then we're going to have challenges associated with manufacturing and distribution and equitable distribution. So I assume that we are going to see kind of waves of disease clearly we can't all stay locked down for 3 years. We can't. But I think it is probably fair to assume that, you know, there will be some relaxations, and then things are going to come on and off a little bit, and that we're going to see spikes or increased transmission over time. I don't know yet what the best answer is to how to address that, but I do think it is probably fair to say that we're not going back to normal anytime soon. We may have to find, I don't know how yet we define what that new normal looks like, but the pre-2020 world, I'm not sure we're going to see for a long time.
Right. I've been telling kind of my colleagues here, this reminds me of, I moved back to New York after 9/11. 9/11 shifted America and shifted New York for sure. And I feel like this virus is definitely shifting the new normal, whatever it is shifting not just Hong Kong, but globally, because SARS shifted Hong Kong in 2003. And in some ways, SARS maybe probably made us better prepare, a little bit better prepare than the other countries. But shifting is, and in fact, one of our guests here, Professor Gabriel Leung, about 2 weeks ago, or even last week, I'm sorry, mentioned the suppression and lift. That's something each of the cities, I guess, sometime maybe coordinated and sometime not. Here we're in you know, near China. China, they're going back to work, and there has been worry of this third wave of you know, a virus coming through from that. And another question related to that is another one of our Dr. Hui from CUHK basically said that no traveling for Hong Kong, or he is not planning to travel from now until, well, for the rest of the year. And so we're really going to be stuck in Hong Kong. And Hong Kong is a very small place. We can't drive anywhere. We can drive to China, but when there's no traveling, it's been kind of cooped up. So is that also what you see? Is that, you know, this suppression and lift, and also no travel plans for a while?
Possibly. I mean, I think, or travel plans where you're subject to, you know, anywhere you go, you're subject to a 2-week quarantine.
Correct.
And then how do we logistically manage that? And some localities might manage that something might be at your own expense. You might be put into a facility that you don't want to go into. I mean, there's a lot of different ways that can be managed, and I think we're going to have to get our heads around that. But it is hard for me to imagine the situation where me personally, where I or my family plan on getting on a plane anytime in the next 6 to 8 months. I'm not sure. I'm not sure we're going to see it. And that it may be different in different parts of the world. My guess is that flights within New Zealand may resume immediately. You know, maybe Australia takes a different approach. And I think for people who are trying to get back to family and are willing to go through a multiple week quarantine, that's going to be a different type of travel than the normal business traveler who's, you know, going somewhere for 24 or 48 hours and then hopping off to the next place. And I think maybe one of the things that will come out of this is that we realize just how much work we can actually get done virtually, and maybe we'll save our carbon footprint a little bit. But I don't know. I mean, I think we're all watching. I know the airline industry wants us all back on a plane really quickly, but everything's going to have to be done in a way that's commensurate with public health.
Well, we certainly are not going to see cruising industry coming back anytime soon. Airline may come back sooner. But I think I want to now kind of end, you know, one of the reasons I want to tell the audience is like, there's a wonderful profile of you in The Lancet from June 2019. And that's how we really got to know your work. And in it, they talked about the Global Health Security Conference that you co-organized in June of 2019. And tell us more about that. And also you had planned to do this 2021. So is that something that it's going to be by virtual, or you know, because in the attendance was quite very well attended in terms of for a field that's kind of relatively new. It's actually there's a lot of people really looking at this and working in this field like you are. So tell us more about this conference in Sydney last year.
Thank you for that. So yes, working with so my partner in crime on this conference was Adam Tamrock-Scott, who's a professor at the University of Sydney, and we both actually came to the conclusion that it was time to hold the first international scientific conference on health security at about the same time, and then found each other and started working together on it. In part because we knew our colleagues, we knew our small community. We didn't know the people we didn't know, but we were starting to get contacted by one-off doctoral students or a faculty member somewhere, or one-off researchers who were actually searching out a community. So we did think it was time to create this community of practice and bring people together, and we were really delighted with the first meeting, which was, as you mentioned, in June 2019. We had over 900 people from around the world. We were able to provide travel bursaries to almost 100 researchers, mostly from lower middle income countries. And we ended up with, I think, over 200 oral presentations, another 200 posters. We were able to bring together researchers with decision makers. We had the regional director generals from the WHO for Wipro and Sero. We had folks from Geneva. We had Africa CDC. So it was really an exciting opportunity to bring together people who were doing research and being able to help translate their research directly to the decision makers of their countries. Or the regions. We also had a side meeting, a military health security summit, where there were another 175 people from, I think, 32 militaries from around the world, really trying to think about what is the role of militaries in supporting health security, and particularly in the Pacific region. So we were pleased. We decided that it was, yes, we should do this again. We didn't want to do it every year, and that decision was actually a carbon footprint decision. But we had decided and planned to go back to Sydney in June 2021. We have announced that we're going to do it. Clearly, if there is still, that decision will be subject to whatever the global situation is, and we're not, we're not going to irresponsibly try to bring people together if it's not good for public health or health security in general. But assuming it is, and I also assume that if we're able to get people physically together, I also assume that we're trying to work out what some mix of in-person and virtual participation would look like, because our community of practice has now dramatically expanded, and we're hoping that. We've also launched a professional association. We're hoping that this becomes a base for this community to come together, to learn from each other. It's learning about COVID specifically, but also all of the other challenges that have not gone away in health security, and that we are continuing to research, to study, and to try to improve. So yes, the call for abstracts is out. I think it'll be open until November. And we will continue to monitor the situation. I can tell you, I'm not quite ready to get on a plane to go to Sydney right now. But 6 months from now, we'll reassess that and figure out what's happening around the world and where we are, and make our decisions based off of that.
Well, a lot can happen between now and then. So if you come to our neck of the woods, we would definitely love to invite you to speak to our audience. And also, I'll give a plug to our Asian Society Australia Center. They have an office in Sydney and Melbourne, and I know they would be very happy to work with you in the future. And on that note, I want to thank you for taking your time to be with us, and also let our audience know that in next week, we are very delighted. Episode 12, we're going to be speaking with Professor Roberto Bruzzone of the Pasteur Institute, Hong Kong U, the co-director of the Hong Kong U Pasteur Research Poll. and he's going to be talking to us next week. And then the week after that, we're delighted that we have a Nobel laureate from Australia, Professor Peter Doherty, will be talking to us in collaboration with our Asia Society Australia Center, talking about his work in this area. And we look forward to welcoming our audience back. And again, thank you, Professor Katz, and good luck. And we hope to welcome you if we are all safe to travel again in about a year's time. Welcome you to Hong Kong, which is still a very exciting place. A lot of the experts are here, and we wish you safety and health. And thank you so much for being with us.
And thank you so much for having me.
Thank you. And we look forward to seeing you next Thursday for episode 12. Thank you and good night.